to detect early cases. How well are you infusing PHCs in what you're doing in Imo State?
Yeah, the primary health centers are key to what we're doing, especially the local governments are actually linked up to them. And most of the times we try to get them to report to the central control office what is happening in their various local government areas. And as was said earlier, in most cases, the patient who comes to nobody knows exactly what is wrong with the patient until they examine the patient. And that crucial period when the doctor comes in contact with the patient can be really a very determinant period. And that's why we're focusing so much effort on what happens in villages, what happens at the primary health centers. And they're actually part and parcel of the entire package. We are not focusing on the city centers and then leaving the primary health centers out of the scope. They play a very crucial role in the whole care gathering. And more now that we are having people visiting from outside the state and they go home straight to their villages, it is the primary health centers that they go to on the first port of call. Themselves and the local government staff are those that are the cutting edge of what we are doing.
Okay, Professor Salako, you are following the trend now and talking about continuous provision of healthcare services and sources. The PHCs are sources of real-time information. If this is so, what is the role of disease surveillance and notification officers at this time? We lost Salako signals. We'll be back on that. Let me go to Fiona. Fiona, well, we have done the opening segment on this. We hear Professor Salako is back. Professor Salako, if you're back to me, I was asking clearly, what is the role of disease surveillance and notification officers if they are active or they are not active in all this?
And for now, at this point in time, the disease surveillance officers really needs to be on ground. This is a period where they have to be very active, collecting data, because this is very crucial in determining the situational analysis of what is going on in terms of the spread of the virus within the community. And the data that comes from there is what is used to plan, depending on the results that come from that data, to plan what next to be done, what needs to be changed, what new things that requires to be added into whatever solutions that NCDC and the government is trying to provide for the public. So they are very, very key in ensuring that relevant data are collected so that we can use that to manage the situation.
Okay, now, if you're just joining us, the focus tonight is COVID-19, sustaining primary healthcare service delivery in Nigeria. Now, quickly, at some point, we shall be taking some reports across the country, and at some point, too, our phone lines will be open. We'll get through to you. You make your calls. You can also be part of the conversation tonight through our Twitter handle at Tuesday Live NTA. Now, to Fiona, how else can PHCs be involved in the fight against COVID-19 besides the African Week of Vaccination?
So we recognize that during outbreaks such as the one we are facing with COVID, the health system gets stretched, and there is a potential for interruption of services such as vaccination. And so WHO has issued guidelines on how countries can look at continuity of services at facility level to make sure that services like vaccination are available for communities to access. We have seen the effects of outbreaks on vaccination services in particular. Last year in the Democratic Republic of Congo, they faced the largest outbreak of Ebola. At the same time, they faced the largest outbreak of measles, where over 6,000 children died. So it is really most critical that facilities such as the primary healthcare facilities in Nigeria continue to provide services to people. And we want to advocate that at the primary healthcare level, understanding that this is usually the closest point of call for communities when they get sick, that we are organized at the primary healthcare level to protect the health workers. They should be well sensitized. They should have the necessary PPE, and they should have the necessary supplies to be able to deliver. So the supply chain should also not be interrupted. And that during the vaccination services that they consider the preventive measures for COVID, so having at least 2-meter distance between the clients, preferably having a well-ventilated space or outside where you can maintain that distance, and that they do deliver the services. I think that is the most critical part of all of this, that we have to continue the services in a safe manner. The guidelines also talk about mass campaigns, which we've been doing periodically for diseases that we are targeting for eradication or control, but that in such situations we do not conduct these activities, but plan to reopen these kinds of mass activities or catch-up vaccination activities once the outbreak has been controlled. So the primary healthcare level remains extremely crucial to prevent outbreaks of other diseases or communicable diseases, vaccine-preventable diseases. So continuity remains extremely important.
Okay, to Hawkins, now you had the plans and a program the executive director has reeled out, Faisal. Now, you are in the field. Would you say truly that everything is in place and you're satisfied with it? If it is not, what can be done to shore it up?
Key things that still is not in place is the protection of all health workers, making sure that they have sufficient supply of face masks and gloves, and if they require gowns and all of those sort of things. The United Nations is bringing in a whole supply, and it's brought some in and will continue to bring some more in over the next few weeks, so that every health worker is protected, and that is the key to it. Then the primary healthcare centres will become more and more important as the centres, as Dr. Fiona said, to attract people for immunisation, to look at nutrition, to look at antenatal, as well as the triage for COVID-19.
Okay, back to Professor Salako. Professor Salako, if the PHCs are not strong enough, how would community transmission be handled? If they are strong enough, we know the solution. Already, Dr. Faisal has talked of the programs in place, so we believe they are strong enough. But if they are weak links, what could be done?
Well, what I believe should be done is to improve their capacity to face the privilege of community patients that will come to them, because they are the point of call when people are sick. So they really have to be trained at this point in time. I'm happy that the supervisor has put it in hand that has ensured that currently the primary care centers that are functioning have been retrained, and they have been linked with mostly this surveillance team. So they have a network that is strong enough to identify a case and to transfer the case to SPC, the activation center. What I think needed to be done more is to ensure that PPEs are made available. And many of these primary health care centers are not within the cities where PPEs are available. So they need to ensure that in the remote areas, PPEs are made available so that when the people who are suspected cases then they can easily have what it requires to see the patient. One of the reasons why a lot of patients are dying and we don't know why they are dying is that the doctors don't have PPE. They are afraid of contracting COVID-19, so they are not attending to many patients. But this is one sub point that we must look at, especially when we look at private facilities, because government hospitals get PPE from government. But who gives it to private facilities? Many of them don't have enough funds to do this, and so they are not very ready to take on patients who are suspected cases for COVID-19. I think this is one important area that government needs to look at and see what can be done to ensure that we get to some of these private facilities so that when cases go to them, they can see them. I know it's a very difficult thing to do, but we just have to face that and find a solution to it. Otherwise, many of the private facilities will be rejecting patients or will be running away from patients, and we've seen a lot of this.
Okay, to our viewers, we just have to apologize. The signals are quite frizzy, but the audio is quite good. Bear with us on that. We should be going to wait, but back in the studio here with you, the program you have planned very well is hand in sync with the guidelines regarding the COVID-19 protocols. Now, how well is the public in tune with this so that they come out en masse to participate?
Right. So I think before we started seeing evidence of community transmission, most of the outbreak response was seen by the general public as a response of the national bodies, the federal government supporting the states to try and control the outbreak. But increasingly with the community transmission, it's become very evident that we cannot make great headways without community members being involved. This is why at the Federal Ministry of Health, MPHCDA and the NCDC, we're working with the Presidential Task Force to see how we can increasingly involve community members, from the traditional leaders, the religious leaders, opinion leaders, political leaders. We're working with community-based and faith-based organizations. We're working with community-based health workers to see how this outbreak response can be community-owned, community-planned, community-driven, community-operated, because it is only when community members feel a sense of vulnerability, feel that they can get sick, and that the solution to preventing themselves from being sick and ensuring that people in the community get the kind of care that they need, then they will take those dedicated interventions to make sure that they are part of this outbreak response. So this is what we're doing. So we've had multiple engagements with traditional leaders, with religious leaders, to pass the message across to them, and we've seen how they started taking this across to the community members. Clearly, the community response is a few steps behind the health facility-based response, but we're trying to fast track the response so that community members actually get involved, and they will be the ones that will advocate for all community members to take those steps, such as social distancing, washing their hands, making sure that they keep away from people who have those symptoms, making sure that people who are sick actually go to the health facility. So for us to be successful, there's an increasing awareness and recognition that communities have to be involved with the health centers, with the primary healthcare centers, working together to make sure that we have a clear mandate, we have a clear goal around how we can stop or control this outbreak.
Where is the current status, or what is the current status of immunization in Nigeria? And after the program, where do you think it will be?
Right, so before the COVID-19 outbreak, we saw impressive increases in routine immunization, right? Unprecedented increases in routine immunization coverage, as evidenced from the NDHS data. We saw a huge leap from the 2013 numbers to the figures in 2018, 2019. And then when we've done spot surveys across the country, we've seen that this improvement has been consistent. Now, with the advent of COVID-19, what we have tried to do is to harp on a clear message that despite the outbreak, there's still that need for us not to lose focus, for parents to take their kids for immunization, because in the end, we do not want a situation where probably some maybe 150 Nigerians, 200 Nigerians die from COVID-19, but many more kids die from perfectly preventable diseases. So, for example, on a global level, we know that between 2 to 3 million deaths are averted, are prevented as a result of immunization. We know, for example, that just because we give the pneumococcal vaccine in Nigeria annually, we prevent over 40,000, deaths. So you can imagine that if we do not give these vaccines, how many kids will be dying from perfectly preventable conditions. So we have to remain focused and say, yes, this outbreak, has caught the imagination of all Nigerians and is spreading in a way that gives us great concern because it is something that is new, right? Nevertheless, we still have the old diseases that we have to contend with. So the primary healthcare centers have to maintain the services so that at the end, at the post COVID-19 period, we don't have a situation where our routine immunization figures really fall below the particular thresholds we're trying to achieve. So we're working together with our partners to see how we can keep those numbers up, encourage people to go to the health facilities. So, for example, even during the lockdown, the Federal Ministry of Health, NPHCDA, came out with a public service announcement encouraging parents to take their kids, to the health facilities, encouraging women to continue to go for antenatal care, because every single day in Nigeria, we continue to have women that die from perfectly preventable causes, right, that are related to pregnancy and delivery. We do not want those numbers to continue to increase because there's a diversion of our attention to just COVID-19. There are other diseases. Malaria still continues to make people sick, continues to kill kids, right? So what we're doing at NPHCDA and the partnership is to make sure that those services continue to be provided in a way that is very safe.
Okay, we'll take a couple of reports now. When we return, we'll go to Fiona and Hawkins, and then Salako. We'll begin with Ibadan.
The federal government inaugurated the Integrated Medical Outreach Program in 409 lowest performing local government areas and medical outreaches in each of the 109 senatorial districts across the country for mothers and children aged 0 to 2 years. Beneficiaries have lauded the initiative, adding that this would go a long way at boosting the health of the rural dwellers and poor Nigerians.
After 3 months, 6 months, we have 9 months, we have 12 months. So after 12 months, this is the 12 months, a year. So I came here to collect for a year immunization. That was Mrs. 2.
Immunization, it helps baby to prevent diseases and to anything that can be harmful to them.
It's integrated because it encompasses all other programs, all other PAT activities apart from the immunization programs.
In Oyo State, preparations are in top gear to kickstart the program at the selected primary health care centers as treatment of minor ailments, health talks, immunization, screening of non-communicable diseases, and general medical consultations will be done free of charge.
It's going to help us to augment our coverage for immunization across different spheres in the AGA where it is carried out. So that will be able to close some of the gaps. Then be able to create more of health awareness for the people. Then it's going to improve and change the health-seeking behavior of the people.
Federal government assistance on the program has been quite of assistance. Oyo State, actually having been a stakeholder, is progressing along with it, and we are recording a remarkable success rate.
As Nigerians look forward to better service delivery at the health sector, they called on government at all levels to look inward and find lasting solutions to the coronavirus pandemic in the country.
Our next report is coming from Jos.
Primary
health care is a part of the three-tier system of health care in Nigeria. According to the World Health Organization, PHC is an essential health care based on practical, scientifically sound, and socially acceptable methods and technology made universally accessible to individuals and families in the community through their full parts. With the novel coronavirus pandemic ravaging the country, tertiary and secondary healthcare facilities and health workers are overstretched to breaking point. The focus is now on primary health care centers to provide basic health care to Nigerians.
Right now, we have some stock out in some of the local governments, so we are sending vaccines to them, you understand, to make sure we don't have that problem. And there is State Emergency Immunization Continuation Center that we have in the state. They are the ones that take care of all these immunization activities, everything.
For Plateau State, with about 1,000 healthcare facilities spread across the 17 local government areas, engaging the PHCs to help in combating COVID-19 is vital, as they will be involved in community engagement, some level of contact tracing, as well as combating community transmission.
With the structure on ground, all we need is to reactivate and do the necessary little training, and we'll swing into action.
Inadequate manpower, as well as training and retraining of health workers, and inadequate facilities are some of the challenges faced by PHCs.
It's every day we do, but the clients are not coming due to lack of how they will transport themselves to the PHC.
Now, health experts say PHCs have the best structures to combat community transmission, handle misinformation, and provide basic health care to all, especially those at the grassroots, and so advocate for upgraded medical equipment, more funding by government and donor organizations.
Those reports sustain the conversation tonight, and also a couple of tweets while the reports were on came in. We'll go to 24, but quickly let me address this tweet to the Executive Director of the National Primary Healthcare Development Agency. It is coming from Nadabude. It says, what can states government do to make quality primary health care accessible and affordable for everyone? How can we use PHCs as an opportunity to innovate and strengthen our health care system in the face of the pandemic? God help Nigeria and deliver Nigerians.
Yes, those are very good questions. First and foremost, one of the reasons why we continue to see primary healthcare centers being sort of the weak link in our health system is because of a lack of investment. There have been several decades of underinvestment by state governments in the primary healthcare systems. There was a time when the primary healthcare system was really within the remit of the local government areas and then the state governments as well. So what we've seen is once funding is not provided for the infrastructure, right, to make sure that the buildings are good enough, to make sure that we have electricity, we have water, and you have human resources, you have the commodities, you have the drugs, then it becomes very difficult for those primary healthcare centers to function. This is why President Muhammadu Buhari, signed into law the Basic Healthcare Provision Fund, which provides an unprecedented amount of money to primary healthcare services, right? To the National Health Insurance Scheme, to the NPHCDA, that ensures that funding goes directly to the primary healthcare centers that will make it possible for primary healthcare centers to be able to fix leaking roofs, to be able to put a coat of fresh paint, to be able to recruit human resources, right? To be able to recruit midwives, nurses, to be able to buy drugs that will be used at the primary healthcare level. These will go a long way in improving the services provided by primary healthcare centers. Otherwise, before the advent of this administration, there was a long period where primary healthcare centers were frankly starved of funds. So we are optimistic that in the next few years we'll see a bolstering of the quality of services at the primary healthcare centers. Nevertheless, what we're trying to do is see how we can make use of those functional primary healthcare centers, provide health workers with the personal protective equipment that they need. We're not talking about the full regalia of a hazmat suit, but really being able to have the face mask, the hand gloves, to be able to have provision to wash hands regularly, and make sure that even before the clients come, they provide an atmosphere, an environment that is safe for the clients to be managed, and even after the clients have left, to make sure that they decontaminate, they sterilize the environment before the next day. So it is really a very complicated and complex sort of preparation that needs to happen different from what they are used to. So what we're doing at MPACD and the partnership is to make sure that the primary healthcare workers are impacted with that knowledge. This is why we're stepping down all of the trainings across the states to the LGAs to make sure that these primary healthcare workers have been upskilled and they have the capability to manage COVID-19 cases when they come to their doorsteps.
Okay. Our first caller tonight is David West. He's calling in from Yenagua, Bayelsa State. Hello, David West. Hello.
Good evening, my brother.
Good evening, David West.
I hope you can hear me clearly.
We can hear you. Go ahead, please.
All right. Good evening. Can you hear me clearly?
Loud and clear. Go ahead.
I hope you can hear me clearly.
Go ahead. Go ahead.
All right. You see, let me say that as a matter of fact, our primary healthcare system, judging from the pictures we have seen from the pictures you have shown us from the state on the primary healthcare, it tells us that our primary healthcare system in Nigeria, as a matter of fact, is really nothing to write home about. In fact, this calls for a worry. And I think the COVID-19 issue has exposed our health system a lot to say that we are really lacking behind, particularly for the healthcare givers. They need protective materials, equipment for themselves. They need enough PPE for themselves. Then, when you go to these primary healthcare centers, in most cases you find out that there are no good drugs for them to administer to patients that comes to them. And in most times too, you do not even see the doctors or the people that are responsible to give you this needed healthcare are not there. Most of them are jostling in the city. And the word primary healthcare means the first healthcare you must get, or the first healthcare you get from the local level. So, in fact, we really need to boost our primary healthcare system in Nigeria, because the primary healthcare system is the one that is closest to the local people, to the most vulnerable people, to the most poorest of the poor. Let us see how we can upgrade it to reduce child mortality and what have you. So the primary healthcare system, we need to, as a matter of urgency, from the experience we have gotten in coronavirus issue, we need to expand it and invest more on it. Health, they say, is wealth. If health is wealth, then let us invest more on health so that we can be ready and have health. Thank you very much and have a wonderful day. God bless you.
Thank you, David West. And when we return, we shall maybe from all the locations respond to David West's concern as raised. The program is Tuesday Live, and we are taking a look at COVID-19 sustaining primary health care service delivery in Nigeria. We take a break. When we return, we'll sustain the conversation. Don't go away.
For now, the best and most efficient way to avoid getting infected is through regular hygienic and sanitary practices, as well as social distancing. As individuals, we remain the greatest weapon to fight this pandemic. By washing our hands regularly with clean water and soap, disinfecting frequently used surfaces and areas, coughing into a tissue or elbow, and strictly adhering to infection prevention control measures in health facilities, we can contain this virus.
Coronavirus is real. Steps to avoid this pandemic. Wash your hands regularly or sanitize your hands. Keep social and physical distancing. Avoid crowded places. Stay at home unless absolutely necessary. Don't touch your eyes, nose, or mouth if your hands are not clean. Avoid the spread of coronavirus. Coronavirus is real.
Tuesday Live, a network issue-oriented innovation talk show.
Thanks for staying tuned. Professor Salako, I'll be with you shortly. Let's go to Hawkins. Hawkins, from all what you've heard, the tweets, reaction by Dr. Faisal, what is your feedback mechanism? What M&E do you have to assess the role and how well this role is being played, given the role you're playing in vaccination and immunization effort in Nigeria?
Very much. And I think David West raised a very big issue here. It's about how do you sustain the primary healthcare system. And the first issue that gives you feedback is how much investment is made in that primary healthcare system, and consistent investment over the years. And a lot has been done over the past 5 to 7 years. A lot more needs to be done in the future. And this is at state level, ensuring that that investment year after year after year on salaries, on primary healthcare centres, even the painting of it, so that they can keep their functioning. The second area of M&E that is crucial is around the community involvement. The community workers going out into the community, encouraging them to use the primary healthcare system, that loop of communications about the importance of immunization or antenatal or even indeed nutrition. And this is critical even at the COVID-19 period, is trying to better understand the community's own anxieties, how they might overcome social distancing in crowded areas, how they might overcome being able to wash their hands in areas where there's no water. 32% of Nigerians do not have access to water. And it's that loop that is so crucial that allows the demand side to be more effective, so that the supply side, which is the primary healthcare system, can respond to the needs of the communities.
Fiona, taking a cue from Nigeria, how well are the African countries pursuing generally issues of primary healthcare? Is WHO very impressed?
A lot of the countries are working towards the commitments they've made for universal health coverage. And to achieve that, we need to have strong primary health care systems in place. And at the level of WHO, we are able to monitor how well The countries are working towards achievement of universal health coverage, looking at the investments into health. We have the target that was set for 15% of national budgets towards health, so that is tracked. We've seen the number of countries slowly progress towards that 15%. Nigeria is still not yet at that level. And we are also looking at besides the investments, we're also looking at the human resource aspects, the human resources per capita, how that is being addressed to meet the needs to deliver healthcare services. We also look at the supply chain, ensuring that the supplies are actually there in terms of medicines and drugs to deliver, and that indeed we also have robust systems for delivery as well as surveillance. So I think overall we are seeing some progress, but still a lot needs to be done. Because we know if we just look at the indicator of vaccines, given that's the topic for today, how well the African continent is going, we've somewhat stagnated around between 75–77% coverage over the last couple of years. So a lot was done to try and build up the coverage, but we are now stagnating around 75–77%. So that shows you that we still have a lot to be done in the countries to ensure we get to universal health coverage.
Okay, I thought Hawkins should react. You react to the call by David West, but Hawkins has done that already. But one more tweet addressed to you, coming from Zamfara New Media. It says, "No country was ready for COVID-19. It is our preparedness and response that is most important. We thank the federal government for assembling the Presidential Task Force on COVID-19 and the NCDC. Our primary health care under one roof is just evolving. We should use CBOs, NGOs, and FBOs working on issues." How do you react to this?
Yeah, I mean, he's made a very valid point that no country was completely prepared for the COVID-19 pandemic. I haven't said that we as a country should not use other countries as a yardstick, right? We as a country, have the sovereign right to say, these are the standards that we want for our people. These are the standards of healthcare that we want for our people. And I believe that what David West said is completely spot on, right? We've not had enough investment in primary healthcare for several decades, right? It is only this administration that has, upped the game in terms of providing resources. It's going to take some time for us to be able to undo all of the neglect in the primary healthcare space. But even with the investment that we're seeing with the advent of this administration, there's still a whole lot that needs to be done. Yes, we may not have been very prepared for this type of outbreak, but I am aware that many agencies, the NCDC, the Federal Ministry of Health, the National Primary Healthcare Development Agency, did some simulations to sort of prepare ourselves for potential outbreaks. This is the same country that did so well with the Ebola outbreak response. So we do have the human resources. We do have the people who can manage these resources. But for us to do a successful job, it takes leadership. That's the kind of leadership that President Muhammadu Buhari is providing. We can see the leadership provided by the chairman of the Presidential Task Force, Boss Mustafa. The kind of leadership to, assess what the situation is, look for the resources that are required to contain this outbreak response. That's exactly what we did. However, we also need leadership at all levels. Leadership at the level of the states, the local government, and our communities, right? This is why we're reaching out to the traditional leaders, the religious leaders, so that everybody, all hands will be on deck in terms of making sure that we contain this outbreak, right? So it's going to take not just leaders at the national level, but also the community-based organizations, CSOs, the opinion leaders, everybody in the community must be involved in this outbreak response. So yes, what he has actually tweeted makes complete sense.
Okay. To our viewers, our team of engineers are doing everything possible to restore signals with Professor Maurice Iwu and Professor Salako, and as soon as this is done, we'll go to them in Owerri and Lagos. But this tweet, I would love first to take it to Hawkins, then to Faisal. You respond to them differently. Hawkins, the tweet coming from Wadata says, "Good evening, Tuesday Live. Talking about PHCs, how trained and equipped are the staff knowing that they live in the local areas, because some of the PHC facilities in some local government areas in Nigeria are not even functioning." What's your reaction?
There's no question there is a human resource capacity issue in some states. Some states are better, others are less good. But there are sufficiently trained people in the country to be able to sustain a PHC structure. And where it works very, very well. Where especially in the rural areas where people do not access the PHCs as well, there are problems. I was recently in Kaduna, for example, where I went to a primary healthcare centre which was full of people, and they were able to respond sufficiently on the nutrition side, on the immunisation side and the antenatal side to be able to accommodate many of those people coming in that day. But it does require that to be done in a sustained basis, especially in the rural areas where there are issues of human resources.
So, Dr. Faisal, how do you react to that?
Right. There's no controversy over the fact that we have a number of primary healthcare centers that are not functioning the way they're supposed to, but we also have a large number of primary healthcare centers that are providing basic services. Like I mentioned earlier, right, it's been so many years of under suboptimal investment in primary healthcare. So there are still a lot of states that need to catch up in terms of making sure that at least we have one functional primary healthcare center per ward. We have seen a lot of governors, take up that policy, and they are already implementing it, making sure that it's not just a question of renovating a primary healthcare center, but also making sure that there's electricity, there's water, and that they are recruiting primary healthcare workers to man these primary healthcare centers. In a number of cases, we see a situation where, people say they've revitalized a primary healthcare center, and all they've done is just put a coat of fresh paint, right? That is not what we're talking about. We're talking about actually having competent, well-trained staff to be in those health facilities. And we've been working with the Nigeria Governors Forum, working with a lot of governors, chairman of LGAs, to make sure that they invest in recruiting additional staff. We're not where we would like to be. This is why if you do not have the human resources in a health care center, of course you will not get the level of functionality that is required. There is a lot of work that is going on to improve this. Of course, this COVID-19 is a setback because it sort of pushes us away from strengthening the health system. But it doesn't have to be that, right? This is a challenge, but the flip side of the coin is that every challenge is an opportunity for us to strengthen our health system, right? And what we're doing with all the relevant organizations and the private sector, our development partners, is to see how we can seize this opportunity of this outbreak to strengthen the health system, to make sure that those routine services continue unabated. But even beyond that, what are the lessons that we can learn? So, for example, in the last few weeks, we've done online training of primary healthcare workers. We're cascading it all the way to the local government and the community levels, right? In the past, this would have been unthinkable. But we think that what we needed to do was to have a hall where we can, train people, face to face. But we've been able to train people using online resources. We've just had to be a little bit more creative, and now we're going to do exactly the same thing all the way to the local government level. So this gives us a unique opportunity to see how we can strengthen the healthcare system, how we can build the capacity of primary healthcare workers without going all the way to the primary healthcare centers, as long as they have the interconnectivity, they have the technology to make sure that they're able to access all of the information that will help build the capacity. So in terms of what we're doing towards building the capacity of primary healthcare workers in preparation for this community transmission, that is what our focus has been in the last few weeks, to make sure that we give them the right information, we give them the skills to not only treat these suspected cases of COVID-19 or even cases of COVID-19 with compassion, with dignity and professionalism, but to make sure that they do not get infected. So the right kind of infection prevention and control skills are being impacted on primary healthcare workers. We're not by any stretch of the imagination saying that we have trained all the primary healthcare workers and they are ready. No, it's a process that we're going through, and we're rapidly trying to go across all of the states, working together with the state.
Has this in any way helped in contact tracing?
Absolutely. So in a number of states, the people who are helping with the contact tracing are the people who live in the community. And who are the people who live in the community with community members? Is the primary healthcare workers. So they've been trained by the NCDC, working with the National Primary Healthcare Development Agency, working with the Federal Ministry of Health and other relevant agencies to make sure that in these communities, once there are cases that are linked to contacts, that primary healthcare workers are supporting that role. But one thing that we've made abundantly clear is that the primary healthcare centers are not centers to manage COVID-19 cases. We can isolate them, but we have to refer them immediately to the treatment centers, to the isolation centers, where people who have been specifically trained and equipped with the right kind of skills will do the work that is required in terms of managing them, making sure that they get the right medication, making sure that they have the right kind of psychotherapy, making sure that they have access to everything that will put them on the pathway to recovery.
Okay. If you're just joining us, the focus tonight is COVID-19 sustaining primary health care service delivery in Nigeria. I'm told the signals from Lagos have been restored. We'll take a report now. When we return, we'll go to Lagos to take Professor Salako to respond to some issues. Stay with us.
Primary health care is the first level of health service usually available to people at the grassroots. It provides the first contact for rural dwellers in meeting their health needs. Most of them provide prenatal and postnatal services for mothers and babies, as well as treat basic health challenges prevalent in rural communities, such as malaria, fever, and other minor ailments. The centers are also used for immunization.
We target children between 0 to 1 year, because we believe that if a child from 0, the day the child was born, till 1 day, if the child can get the full immunization he or she is meant to have, the child should be able to live a productive life.
The primary health care centers also serves as a rallying point for visiting health officers who routinely come for special services in health care delivery, including sustained vaccination and enlightenment programs.
A woman comes in pregnant, you make her aware of other services she can utilize when she has come into the clinic. You educate the woman about the available vaccines. A knowledge about what she needs during pregnancy is there, what is expected. Then after childbirth, what she should do, especially for the safety of her child.
These services are going on in spite of ongoing challenges associated with COVID-19, as where necessary special arrangements have been made to overcome logistics challenges. In spite of the obvious limitations of these health centers in terms of facilities, they often identify patients who might need to be referred for further examinations in the face of COVID-19.
What are Nigerians saying? Let's listen to a Vox Pop.
So our
primary healthcare system, I think basically we're doing well. We've been getting reports that we have victims that are actually recovering and doing well. When you talk about Africa, Nigerians are, I think, we're Africa's big brother, right? So I think we have what it takes.
This time around, I'm giving them kudos. The way they are taking care the health system now, the way they are pushing it up, the way they are, adding, helping, trying to help situations around, they are trying.
Thanks for staying tuned. You can still be part of the conversation through our Twitter handle at TuesdayLiveNTA or through the phone number displayed on the screen. Back to the studio. Dr. Faisal, education is key to what you're doing in Nigeria. Given what's on ground, immunization, primary health care, COVID-19, how well are Nigerians conscientized to be aware of what to do, what not to do, and where to be at any particular time?
Right, I think I've been very impressed by the work that is going on in terms of people's knowledge around COVID-19. You can see on social media, you can see on TV how the NCDC has really worked with a number of media houses with both print and electronic media to send consistent messaging, around COVID-19. It's been unprecedented, right? And then when you see some of the conversations that are going on, yes, there's a lot of fake news, there's a lot of rumors, but one thing that is not lacking is that engagement on COVID-19. We feel that, with community engagement, with our engagement with the traditional institutions, with religious leaders, they are now beginning to give the correct messages around COVID-19. And our primary healthcare workers are also going into the communities, working with the village health workers, with traditional leaders, with traditional birth attendants, and the correct information around COVID-19 is now going out there. So we feel pretty confident that, in the last few weeks, yes, we've seen some miscommunications, but I think there seems to be a steady and progressive increase in correct information sharing. And I believe that by the time the community members own this response, then it will be the community members who will be passing on messages around health promotion, right? We've seen this happen even with Ebola. You recall that in 2014, there was a time that people said that if you wanted to protect yourself from Ebola, you should drink salt water, and, people did all kinds of crazy stuff, right? But over time, all of that stopped, and then people got the right message. I think people are getting the right messages. I think the Presidential Task Force with the daily media briefs is doing an outstanding job of communicating very clearly to all Nigerians so that there's no knowledge gap, there's no information gap, right? And I think this has to continue so that people know exactly what is the correct thing and what is the wrong thing. I believe that because of the level of communication that we're seeing, that people are conscientized, there's social mobilization that is going on. What we probably need to do more of is to increase that interpersonal communication, to see how more of the religious leaders will speak more, how more of the traditional leaders will speak more. And I know that in our communication with the Ministry of Information, with NTA, as it were, that all of those are happening in the background, and in the next few days we will see how more of traditional leaders are coming out to speak very clearly against rumors, against stigmatization, against discrimination. Okay, right?
Let me hold you there. Our next caller is Mohammed. Mohammed is calling from Borno State. Hello, Mohammed.
Hello, good afternoon.
Good evening. You're on to Tuesday Live.
Okay, good evening. How are you doing?
Fine, thank you. Go ahead, please.
Okay, I want to contribute on the topic you are discussing.
Go ahead, please.
Okay, so the contribution that the Presidential Task Force on COVID-19 that we are doing is not in question. We want to commend them, and we want to commend the federal government for the proactive measures taken against this disease. But the point I want to raise is that, as we heard from one of our representatives from Borno State, she has presented to the National Assembly. She said that if federal government would allow people to go to market with some condition of social distancing, masks, and so on. Why the federal government will not allow people to go to the masked churches so that we can pray and appeal to God Almighty so as we can get relief spiritually? Thank you. God bless you.
Thank you, Mohammed. I believe Mohammed has gone off, but although it's still related, he's talking up purely on COVID-19 and what the Presidential Task Force is doing. I hear Professor Morris, who is up on track now. Prof, sorry we lost you for some time. And the question I want to put across to you down your back is, how do you just oppose or place trado medicine, scientific medicine, immunization, vaccination, COVID-19? How do you place them?
I think they are all part of the solutions to the problem. In terms of the vaccination, I think, like the PG said, I think those are key factors. The ultimate will be to find a vaccine that will take care of of COVID-19. But before then, the person will use what we have to treat our problem, and namely, if there are antiviral agents that have been proven, that pass through the process, that have been passed through the regulatory agencies, we should give those a chance. And one of the things we are actually asking from our own end is not that we should take the risk of having untested products, but we should be able to have an open mind and believe that Africans are as good as any person outside here. And that if we follow through the WHO guidelines, the global good best practice, we should be able to have products that can be utilized against COVID-19. And one of the misconceptions out there is that COVID-19 is entirely new. No, it is not. It is the same thing as the SARS coronavirus that came out earlier. This is the SARS-CoV-2, and they have so much in common that if we apply some of the things that were used earlier, that we'll be able to minimize the suffering and, much more importantly, curtail the number of deaths. But nobody's advocating that we use untested products. Nobody's advocating that we try to shortcut the process of regulating a new drug. Nobody's also saying that we have a cure for COVID-19. But all we are trying to say from a scientific point of view is that we should maintain an open mind and be able to apply things that have gone through the rigors of science. And that was one of the issues that brought behind this exercise.
Thank you so much, Professor Morris. Let's take this caller from Taraba State, Aminu. Hello, Aminu. Hello, Aminu.
Hello. Hello, can you hear me? Can you hear me?
Go ahead, Aminu, we can hear you.
Can you hear me?
Yes, we can hear you. Go ahead, please.
Yeah, well, thank you very much. My name is Aminu. I'm calling from Taraba.
Go ahead. Go ahead, please.
I want to most sincerely make my own contribution by first and foremost appreciating the leadership of the chief executive of the National Primary Care Development Agency, in person of Dr. Faisal, under the able leadership of the Honorable Minister for Health.
I mean, talk, please. We can hear you.
This is the first time in the history of the country where primary health care is being considered as in the forefront of providing a very important intervention in terms of a pandemic.
I mean, you don't need to listen to yourself. Just continue speaking, please.
That is of coronavirus. Apart from that, this is also the only time we have also been able to see a lot of reforms in trying to bring up to life primary health care so that primary care can provide adequate integrated primary care services in line with the norms and terms that have established the sector. Taking into consideration of the fact that 70% of the healthcare needs of our people are domiciled under the primary care level. So all I want to say is we need additional funding. Sorry, the agency needs additional funding, that is National Primary Care Development Agency, through the Federal Ministry of Health, so that the state primary care development agency, as well as the local government primary care departments, will at least provide the required integrated primary care services for the benefit of our people. But by and large, and then the Honorable Minister for Health, for these very important interventions that they have put in place. Thank you very much.
Thank you, Aminu. Well, Dr. Faisal, that was a big advocacy there from Aminu for your agency.
Yeah, thank you very much.
Well, quickly, let me go to Fiona and Hawkins. This question I throw to the two of you respond. After Fiona, Hawkins could respond. Can we estimate clearly the number of children saved from premature deaths as a result of effective immunization and vaccination efforts in Africa?
Thank you for that question. And we continue to gather the evidence. Every year we are tracking the numbers of children that are reached with vaccines. And we also track the deaths that happen due to vaccine preventable diseases. We know that the last count, there were over 2 million that died from vaccine-preventable diseases in the region. So we know that these are lives that could have been saved if they had had the access to vaccines. And that forms part of our advocacy to governments, that we have tools that are cheap, tools that are actually free of charge to governments in the public sector, and should be also free in the private sector, available to help save lives. And this is a week where we need to pass that message that we cannot continue to see children dying of preventable diseases. So the number is still way too high. And we can actually do a lot more to make these vaccines accessible to children.
Hawkins, how do you react to this?
First of all, I want to echo your previous speaker on congratulating the leadership of the MPCDHA on the investment they have made in primary health care throughout the country, but also to the heroes of those who are actually delivering the services on the ground, both in the primary health care centres, but also in the communities, and trying to galvanise the demand for healthcare. But there is a long, long way to go. The number of children under 5 that die of respiratory infection every year is in the region of 160,000. There's much more that we can do and should do. In actual fact, today the Johns Hopkins Bloomberg School of Public Health have put out a warning that up to 6,000 children could die a day, not of COVID-19, but as a result of the impact that COVID-19 will have on the health systems. If you extrapolate that, in Nigeria, that might be something in the region of 960 per day. And that's why we're here today, is to ensure that the primary healthcare system is sustained in spite of COVID-19, and to be able to respond to COVID-19, so that those children are cared for, and those children will not die as a result of what is happening at this point in time.
If Professor Morris, who is there, will go to him now, and what we'll be asking him is, what testimonies will he give regarding the job he's doing now in Imo State as chairman of COVID-19, working in sync with PHCs in Imo State?
Yeah, what we are doing here in Imo State, like I've mentioned, the primary health system is very focal, very, very, very important in the whole overall scheme of things. We are concentrating on training and education. There's so much mistrust out there. The average person in the villages believes that this is a contrived illness. And the first problem was to deal with the issue of misinformation. And we also noted what has been said earlier, namely that post-COVID-19, if we leave the healthcare sector the way we found it, then we would have failed. Whether or not we're able to prevent the COVID-19 or not, we should have a better primary health care after COVID-19. So our emphasis has been trying to strengthen the existing infrastructure, trying to make sure that each of our 27 local governments can be able to have meaningful health care for our people. And we're also making it very, very important that among the three most vulnerable groups, the healthcare workers are one of them, apart from those who are above 60 years and those who have existing conditions. The healthcare workers are one of them. So we treat them as a very vulnerable group, and that is one of the cardinal aspects of our program. We do what we call communication, important, education, and then prevention. So when we package all this together, we cannot even move without the primary health care people. So the primary health care centers are really key. And I'm glad that somebody called thanking the federal government for the work they have done at that sector. I think there is an activation going on. The roads had taken so long to happen that it will not happen. The victory will not happen overnight. As the WHO person said, we will have a long way to go. And then I think, as also the Chinese said, the journey of 1,000 miles starts with one single step. We are taking the right step in the right direction, but we have to sustain it. We don't believe that we are there yet. But this COVID-19 has shown us very clearly, now nobody can travel out. Nobody can hop into the plane and go overseas. Most people are in their villages, and when you are sick, you can only be treated at their primary health care. In fact, you can't even go to the cities. So that makes it that for us to be able, for our own personal reasons, for our own individual needs, we have to strengthen the primary health care. And that is what is happening now. Luckily for us in Imo State, we do have the personnel, but they have to be trained. We do have infrastructure that decayed over the years. We have to work them up. We have not we're also making sure that all the isolation centers we are setting up must be near a healthcare center. The idea here is that even if we don't have cases, even if we don't have the surge that we are fearing why they were set up, at the end of the day, we should be able to have them to be as an annex to existing healthcare centers. And I think that is what we are doing, and we believe that is a better way to go, rather than to have sophisticated centers in the cities and have roads in the villages. So far, that plan is working. And much more importantly, in terms of information flow, this is a two-way thing. We are learning a lot from those who are administering healthcare in the villages. That ones who tell us about those who have come home, those who have also been sick, those who have traveled and came back. So in terms of surveillance, without them, the surveillance structure will collapse. Without them, the case tracing will also collapse. So it is a situation here that we are realizing that the entire infrastructure in terms of healthcare, money has been spent more in the cities than in the tertiary centers, but where the need is, the pivot is in the primary health system. And so far, that is paying off gradually, having them been a very essential part of the process. And also, even particularly the private health sector. We're also trying to see how they can benefit from the government's own resources.
Thank you, Professor Morris. Back to Dr. Faisal. I imagine the widths and how enthused the Nigerians will be if all this put in place is sustained. What plans do you have in terms of sustainability after now and beyond?
Right, so the COVID-19 outbreak is a very huge opportunity for us to sustain the gains that we've established, like I told you earlier, before the outbreak, we actually had seen an improvement in routine immunization. We're beginning to see an improvement in some indicators such as antenatal attendance. We're seeing that we're averting a number, record numbers of kids who are under 5 dying from perfectly vaccine-preventable diseases. But I think what this really helps us do is to work together, different agencies under the Federal Ministry of Health, under the able leadership of the Honorable Ministers of Health. We're seeing a new agency such as the Nigerian Centers for Disease Control really step up, right? So this agency is what, 2-3 years old?
Let me just hold up briefly and take this caller from Maiduguri. Mohammed is calling from Maiduguri. Hello, Mohammed.
Hello.
We can hear you. Go ahead.
Hello. Good evening.
Good evening.
How are you?
Fine. Go ahead, please. Go ahead, please.
Okay, sir. Okay. I'm very happy to, involving primary health care agency. Simply because NCDCs and presidential committees, they're more relying or considered. Hello?
Mohammed, go ahead, please.
Okay.
Can you turn down the volume of your television set?
Consider this thing in the urban center. So most of the people, at least 70 to 80% people are, under primary health care agency. So that was the reason why I'm very happy.
Thank you, Mohammed. Thank you so much. You could conclude.
Right. So, like I was saying, in terms of sustaining the health system, right, it's going to take a lot of investment, right? We cannot expect a Mercedes-Benz health system if we have investments that can only procure a motorcycle, right? So if we want a quality health system, clearly we have to put in the investment that is required. Like I mentioned earlier, President Muhammadu Buhari has shown his clear leadership, his clear vision for a stronger health system in Nigeria by ensuring that he prioritizes primary health care. Whatever he's saying, he's put it to action, right? He's invested money in the basic healthcare provision fund to make it possible that primary healthcare centers get the funding that they need. But apart from that, right, how do we prepare for the next epidemic, right? We've seen a strengthening in terms of providing funding for the NCDC and allowing NCDC to take a leadership role when it comes to this COVID-19. We're now beginning to see how, as the community transmission, increases, NCDC is working more with NPHCDA, right? I salute the leadership of my brother, Dr. Chikwe, who has made it very, very clear that this was not a disease that anybody knew was going to happen, that there are challenges, and there is no doubt that we still face challenges in terms of our response to the outbreak. But there is no doubt as well, there is no ambiguity about the fact that everybody is working hard to see how this outbreak will be contained, how this outbreak will be managed in a way that it comes with the most minimum of fatalities, right, and minimum morbidities. And I want to salute again the leadership provided by the Presidential Task Force. I think that has made a significant impact in terms of our ability to not focus on just the health aspect, but to look at all of the multi-sectoral impact of COVID-19. It will be very critical that we sustain all of this multi-sectoral collaboration, ensuring that funding, not only from government, but also tapping into the private sector. The private sector has come to support the COVID-19 response. That support needs to continue all across post-COVID-19 so that we're not talking only about the resources that the private sector provides. The private sector also has advantage in terms of how they manage efficiently and effectively, how they deliver, how they execute on tasks, right? They also have the advantage of providing technology. We will have to now see a way of streamlining, of harnessing all of these capabilities towards a health sector that in the future will be able to provide quality health services for all Nigerians. I do not think that we can live through this COVID-19 and go back to the days where we do not invest enough in the health sector.
Thank you. If you're just tuning in, the program is Tuesday Live, and the focus is COVID-19 sustaining primary health care service delivery in Nigeria. Just reaching us now is the latest report by the Nigeria Center for Disease Control says that Nigeria has recorded 146 new confirmed cases. Of the numbers, Lagos is still leading with 57 cases, followed by Kano 27, Kwara 10, FCT 1 case. This brings the total figures to 4,787, with 959 discharged and 158 deaths. That's the update on the cases of COVID-19 in Nigeria. And quickly to Dr. Fiona. Dr. Fiona, just this evening we heard that the World Health Organization is meeting with traditional medicine practitioners in Africa. What's the update and what informed the meeting?
So, as you know, in this era of COVID, we are working hard at the global level to accelerate the diagnostics, therapeutics, and vaccine research. We all know that we do not have substantive evidence on the therapeutics that could be used for treatment of COVID patients. We also do not have a vaccine. And so the global community led by WHO launched the acceleration of COVID-19 tools, SCT, about 2 weeks ago to try and galvanize global support and acceleration towards finding a cure, finding the treatment for COVID. And we are currently trying to pull the evidence from the field as to which therapeutics are available in a very coordinated manner through one multi-country randomized clinical trial looking at various therapies, the antivirals, chloroquine, hydroxychloroquine, and comparing that with the normal supportive care that is provided for COVID patients. And we would like to see which treatment would be most effective. So that is something that is going on. In the meantime, countries continue to innovate. So we've had the innovation from Madagascar, for instance. We've also had several countries coming up with traditional means or treatments. And WHO welcomes the innovation. And we are working with countries to try and gather the evidence as to the effectiveness of these traditional regimens, in addition to the drugs that are being studied in the large multi-country study. So we did issue, the regional office did issue a statement on this last week related to the traditional medicines currently that need to be validated. And Nigeria is also going to be part of that process. Countries are encouraged to be part of that process. There are guidelines for the validation of these traditional medicines. And we hope that at the end of all this, we will have evidence of which are those effective treatments, whether traditional or the drugs that are currently being studied to provide to the global community. And so the regional office is, to go back to your question about what is currently being done. This is the effort following that public messaging that went out from the regional office last week about traditional medicines. So trying to gather the regional countries that have expressed interest to take this work forward.
Okay, quickly, let's take this tweet before I go to Hawkins, then go to Professor Morris Wu and Salako. Suleiman Ibrahim from Kaduna says, what is it that government demand from its citizens is to stay indoors and die of hunger and starvation, or a proper palliative will be given to the vulnerable? The next one says, Aminu says, I want to salute the leadership of the Federal Ministry of Health and the National Primary Health Care Development Agency for its commitment towards repositioning our PHC with lean available resources. 2, PHC takes care of over 70% of our health care needs with more funds, human resources for health capacity building. We shall be there soon. You want to react to that?
Right. So I can imagine and understand the frustrations that the earlier tweet is expressing in terms of having to stay indoors and then the lockdown and sort of the depressed ability to get money, to make money for people, to be employed. But I will not state it as a show of a lack of concern on the part of the government. I think in multiple ways, Mr. President has really called for a social awakening to recognize the risks that we face. And I know very clearly that Mr. President is a man of integrity, is a man who cares about Nigerians. I don't think that is in doubt. And for him to take this step in terms of announcing the lockdown, he did it in the best interest of all Nigerians. And it's a difficult time for everybody. So we sympathize with what people are going through. But Mr. President also very clearly in his announcements, in his speeches to the nation, sympathize with the situation. And, we are a resilient country. We're resilient people. These are difficult times, but I have no shadow of doubt that we will emerge from this a stronger country based on the lessons that we've learned around how we have to strengthen our health system and the sacrifices that we make for one another on behalf of one another. And these lessons are lessons that we will pass on to other generations so that in the future, if we ever have to come across these types of very difficult outbreaks or pandemics, God forbid, that we have a generation that is better prepared to manage it, and probably will be able to develop faster treatment models, treatment mechanisms, vaccines that will be able to protect citizens. So I do appreciate where he's coming from, but I know that these decisions are not taken lightly. I know even when the chairman of the Presidential Task Force, Barrister Boss Mustafa, has to take such decisions to Mr. President, it is not taken lightly. It is discussed at the Presidential Task Force level, with the greatest degree of seriousness, because nobody wants to see any Nigerian suffer, but we're at a place where some difficult decisions have to be taken now so that we create and present a better future, not only for Nigerians, but future Nigerians will look back at some of these difficult decisions, some of the difficult sacrifices that we've made, and say this generation of Nigerians, did not hunker down, did not, prevaricate without taking difficult decisions for the survival of this country. And these decisions are for the survival of this country so that this pandemic doesn't overrun a whole generation of Nigerians. So we appreciate all of the sacrifices that Nigerians are making, but they are worthwhile sacrifices that will pay the greatest dividends for the future.
Okay. Peter Hawkins, I had left this question for now for you. How do you rate the coverage area of immunization effort in Nigeria? Is it impressive?
This is my second time being based in Nigeria, and I saw it before. It is very, very impressive, and it's moving far and fast. But as Dr. Faisal said, it needs sustained investment to continue that route. It's on the right path, as your professor has said. The inconsistencies between some states needs to be addressed and needs to be addressed very, very quickly. And then we can move on as a nation where the people themselves feel that they have a primary health care system that is both valuable to them and they can be proud of to be able to take the services forward.
Well, to Fiona. Fiona, so in all these, looking at the primary concern for tonight linked with COVID-19, we talked about sustainability. What's your assessment after now, if all what has been put in place is sustained?
I think a good measure of success will be, yes, the strong health system that can deliver services in a sustainable manner. But more importantly would be that communities are empowered and taking ownership of matters that regard their health. What is really sustainable is when individuals understand the benefits of vaccines, of health services, when individuals understand the risks involved in diseases like COVID, that they understand the disease, they understand how to protect themselves, how to protect their neighbor. It is a collective whole of society approach that will help us to really address this outbreak, but also address primary health care and the drivers of child and maternal mortality. When the individuals, when the communities are actually in the driving seat. So I think looking at it both ways, the health system itself, that it is delivering in a sustainable manner, but you also have communities that are demanding and taking the ownership of matters related to their health. I think that is when we can really see success.
Well, let's go to Professor Salako. Professor Salako, well, we have to just apologize. Beyond us, the signals have really been bad. But just one question before signing off tonight. In all what we are looking at, PHC, how do you rate the dialectics of knowledge, ignorance, and conspiracy?
Thank you very much for your question. Knowledge and ignorance are not the same, really. Knowledge is believed to be power. Ignorance is the recipe to disease, poverty, and of course death. So at the primary care level, I believe that improving the knowledge of workers at the primary care level will assist them in doing their work very well, and will be able to put to the use of the community who comes to them, and will be able to provide knowledge in terms of, for example, take COVID-19 as it is now. There's a lot of knowledge flowing out of NCDC, the PTL, many NGOs, many health facilities, talking to the community about what needs to be done to prevent them from contracting the disease. I believe that we've learned a lot in this period, and as much as to know that ordinary hand washing will be life-saving in a situation like this. So when people of a country are knowledgeable about a pandemic like this, we would have had control, let's say, about 30% of the situation, because people now know what they need to do and what they don't need to do to prevent them from catching the disease. So I believe that the primary care level as it is now need to be strengthened. In this situation, we should look at the centers outside the cities, the issues of getting the appropriate healthcare workers to stay there, to be able to do the proper thing. We may need to begin to look at duties of some of the senior health workers being shared with those who are there, because these days we talk about duty sharing or task sharing. Or in fact, sometimes we want to teach some of these people to be able to do things that some senior doctors may want to be doing because they are not available in the village. These things are things that can strengthen the primary care level, and then get the doctors or the nurses to visit the place maybe once or twice a week. Once we are able to provide them with this capacity, then they are in the right position to provide good knowledge to build the community around them. I think that so far, what we have learned in COVID-19 and this pandemic is a lot. It has changed the way Nigerians do things. It has brought out the best of us. We have provided or produced many things that ordinarily would have been importing by now. We are already doing them, and we are doing a lot more. So I think that the things that we have gained in this situation is something to make us better post-COVID-19.
Professor Salako, thank you so much for being on the program tonight.
Thank you very much.
Professor Salako is the Director General, Nigerian Institute of Medical Research. He joined us from Lagos via Skype. And to Professor Maurice Iwu. Professor Maurice Iwu, what's your last... He's not there right now, but we watch at this point to say a very big thank you to him for being part of the program, despite the difficult signal challenge we had tonight. And I must say to Dr. Faisal, what's your last word on this program tonight?
Clearly, with the COVID-19 pandemic, a lot of people are working very hard. I've seen people, work like 24 hours. Public service is a sacred trust. It is a trust that members of the Presidential Task Force hold very true to their heart. I've seen a lot of gaps in what has happened in terms of the outbreak response, but I've also seen some outstanding and amazing leadership provided by Nigerians, right? We're all working together. There are things that we'll get right. There are things that we may not get right. But in the end, what is very important is that we move in the same direction as all Nigerians, right? Knowing that our destinies are all in the same direction, and that if we hunker together, that we can beat COVID-19. And if we beat COVID-19, we come out of this COVID-19 period a stronger and more united country. I know we can do it. We've done it with polio. We've done it with Ebola. I'm sure we're going to do the same thing with COVID-19.
Faisal, it was nice having you on Tuesday Live tonight.
Thank you very much.
And to Fiona and Hawkins, thanks so much for making time tonight. Before we go, 146 new COVID-19 cases have been confirmed by the Nigeria Center for Disease Control on Tuesday, 12th May 2020, across 20 states, bringing the number to 4,787 cases in Nigeria, with 959 discharged and 158 deaths in 34 states. No new state has reported a case in the last 24 hours. The breakdown shows that Lagos has 57, Kano 27, Kwara 10, Edo 9, Bauchi 8, Yobe 7, Kebbi and Oyo 4 each, Katsina and Niger 3 each, Benue, Borno, Plateau and Sokoto have 2 each, while Gombe, Enugu, Ebonyi, Ogun, Rivers and FCT have 1 each. With that update, it's a wrap on Tuesday Live tonight. Thanks so much for being part of it. On behalf of all of us, bye-bye.